This is an actual picture of the credit card size cassette placed next to my American Express card, with my name changed, of course. This cassette is designed to hold 450 spots, representing 450 disease proteins that will be tested. The cassette sensor surface is 7 millimeters in size, but if we increase it to 1 centimeter, it can hold up to 1,000 tests. On the right, I am now showing you a planned array that we printed with each disease antigen numbered from 1 to 48. As you can see here, the array is 25 columns by 18 columns up and down. That gives you 450 spots. Each number corresponds to a disease protein which was printed on the glass surface as shown in the example on the right. This is a picture of the array before the blood sample was run over the glass surface. The spots will change once the antibody is attached to the disease protein on the printed glass surface. The commercial cost to do this will be about 5 cents per test, reducing the cost per test exponentially from what is offered today in any laboratory setting anywhere in the world. To show the flow of the fluid in the cassette, I have placed a drop of diluted serum on the pad that normally would contain the blood. The pad filters the cells from the serum. It is the serum which then flows down the channel in the direction of the arrow shown on the left and illustrated on the right. Once the serum reaches the glass sensor surface, the antibodies in the serum immediately start reacting to the targeted diseases that are present on the 7 millimeter sensor surface. The antibodies within the patient's serum only attach to the targeted diseases that are on the sensor surface. If the antibodies attach, the height and mass of the attached antibodies are read by the technology and reported to the doctor or his office. Imagine again that you're not feeling well. You might have a fever, a cough, pain in your joints. So do you go to your doctor's office and he can run up to 450 blood tests in just a few minutes. And before you leave the doctor's office, the doctor will have the test results in his hand. He will be able to make you a diagnosis faster than ever before. This is a game changer for the timely delivery of medical care. I'm now going to introduce my partner, David Raylan, who is going to draw a drop of blood from his finger, and we're going to test his blood in the point of care system. Watch this.
Now, the reason the gloves are off is that I'm going to run my untreated blood through the check here. I have a fairly standard diabetic finger stick device here. And work up a little blood here. And go. Just a little, make sure it's going to bleed. Okay, I think that's enough. Okay, 15 microliters going in.
These are David's lab test results. If you look, you will see quite a few positive tests for thyroid problems. He had types of exposure to 3 different flu viruses. And in addition, there are some autoimmune reactive antigens seen on the test array, much to his surprise.
This is the original nanostructure of the array. These spots are a few nanometers thick and just a single layer of protein. And we can see this live with the instrument. What we're going to see is antibodies bind to it in real time. The area of the array that we're looking at is only about 6 square millimeters. And in that 6 square millimeters, we have room to do at least 450 different tests, if not more.
We have acquired some diseased blood from a commercial laboratory. We know what diseases this particular patient has. We're going to now run that serum on our commercial system, and we'll see what we can detect. Watch this. This is the Polaron unit that we designed a little while ago. This unit will basically read the assays that we did today. You're going to see the arrays as they develop, along with some graphics that will demonstrate the growing of the spots. The graphics have thresholds, so they will not appear until the threshold has been reached. The spots, nevertheless, may appear first. The final result at 5 minutes will give us a mature assay, and all of the results will be complete at that point. This is minute 1. This is minute 2. This is minute 3. This is minute 4. This is minute 5. And you will notice that there are a number of spots that have lit up, and I'll go through those with you now. This is a picture of the array just as I showed you in the model earlier. The patient's disease serum has been running for a little under 5 minutes, and we already have test results. This one is the H1 flu antigen, which is positive. This could mean that he actually had H1 flu or an H1 flu sometime before the test was taken, and he could have been immunized even against the flu virus. More relevant, however, we are showing positive responses to the Zika virus here and the dengue virus here against 2 different disease antigens. This patient got dengue fever, possibly contracted at the same time as he got the Zika virus. They could have lived in infectious disease areas. With the Zika and dengue both positive, this means that they were exposed to the virus and developed immunity to them sometime in the past. We don't know if these actual patients were sick with Zika and dengue fever at the time the tests were taken. Only the doctor would know that from their clinical presentation. For example, were they sick? Did they have fever at the time the samples were taken? We were able to detect both dengue and Zika viruses antibodies